This week, we will continue to learn about some tools that can be used for informal observational assessment. Checklists, rating scales, and rubrics are tools that allow teachers to collect data on forms that are created prior to the observation. These forms can be helpful in gathering data quickly and can ease the burden of collecting observational data. A checklist is a type of assessment instrument. It is an organized document that lists skills, abilities, and behaviors. Frequently, checklists are designed in a grid format with the children's names listed along the top and the skills or behavior on the left-hand side. Checklists record whether the skill or behavior is observed or not. It's a yes or no answer, either by a check mark or by recording the date that the skill was observed. Checklists are particularly helpful in recording information about groups of children, and they can also be used to record information about more than one skill for a single child. Checklists can be used to record information about development or learning and can be customized to fit the curriculum of the classroom. They might also be chosen so that educators can record children's progress towards goals and objectives. The checklist items in each area indicate how a child is progressing through development and experiences. Teachers can use checklists to trace the sequence of development and also be realistic in their expectations for children. Checklists can also serve as a guide in planning learning experiences for young children. If a checklist is sequenced by developmental levels and ages, a short study of the checklist will let you know what a child is ready to learn. The checklist can serve as a wonderful tool for planning experience for children within their ready to learn or zone of proximal development. Checklists may be available as pre-made assessments, such as the creative curriculum, or they may be designed by early care professionals to track specific skills. To design a checklist, McAfee and Leong recommend the following steps. First, choose items for the checklist that will represent the skills and dispositions that you expect to see. We know that children who are at the same age develop at different rates, so be sure to include a wide range of items to observe for. Children with disabilities may need to have categories narrowed into even more levels to show smaller increments of growth. Group the items so that they make sense and are easily found while recording. You might think about grouping items in developmental areas or in academic areas such as math and literacy and science. Use spacing and categories that make it easy to identify the places to write the information. Identify observable sub-skills or steps for the expected behavior also. The more explicit the item, the less likely observers are to be confused about what they're looking for. For example, if you want to know which children know the first letter of their name, the items might be stated as states the name of the first letter of their name when requested. So in other words, they're verbally stating it. And then also identifies first letter of their name in print. And those are two different levels of understanding the first letter of their name. Write the items on the checklist from a positive perspective. That is, write what the child can do. And this will make it easier to see the related behavior. Also, if you can, always leave a place to write comments. It's very likely that a yes or no answer is a limitation of the response on the checklist, and you'll need some documentation for something interesting that may be important or for planning or later analysis. One of the advantages of using checklists is that early care professionals can record a large amount of information in a short amount of time. The checklist can be used for the entire group of children, or it can be just used for a single child. The content observed can be customized to fit the group and the specific classroom learning goals. The checklists can be designed ahead of time and embedded in planned learning experiences. Also, if the checklist contains information on the entire group of children, it's easy to see at a glance where curriculum planning needs to be. A disadvantage of using checklists is that early care professionals must know what they wish to observe in advance. Because the scope of information is narrowed, it's possible to miss some important information. Many skills, behaviors, and abilities can't be recorded with a simple yes or no response. While checklists are a great way to organize observations of children, they don't replace the narrative records of a child's development. Checklists may take some time to become familiar with and learn how to use. However, with experience, they're easy to use and can be used to record a variety of assessment data. As mentioned earlier, checklists can also provide an easy and efficient way to plan curriculum experience for an individual child or a group of children. Rating scales are a form of documentation in which pre-designed sets of qualities, skills, or behaviors can be rated by level of performance. Early care professionals rate the degree to which the behaviors or skills are present. Rating scales require teachers to make a judgment of the extent that a behavior is present. One common scale describes levels of frequency, such as hardly ever, sometimes, or most of the time. The advantage of rating scales is that early care professionals can think ahead about the skills and qualities and behaviors in question, and then they can evaluate what they've seen and summarize those on a rating scale. Rating scales can provide a convenient method for judging skill development. However, since observers must make judgments in order to complete the scale, it's necessary for the supporting observation information to be present. Early care professionals who use rating scales must be careful to apply them fairly and accurately. Educators may be interested in rating the quality of a behavior, skill, or work product, or they may wish to know the frequency that the skill or behavior occurs. Each of these types of ratings indicates a level. One uses words related to quality, such as advanced and proficient, and others use words related to the amount of something, such as never or sometimes. Rating scales always contain 2 or more levels. The words used to describe each level must be selected carefully. It's important to be sure that anyone rating the child will understand the differentiation each level describes. It's also important to select words that cannot be misinterpreted. If someone who did not see the child reviews the rating results, it should be easy for them to understand what the levels mean and how they were applied. The chart on this slide provides an example of a rating scale for an 8-month-old child. The rating labels of regularly, sometimes, and rarely indicate the amount of time the skill is exhibited by the child. The items of walk forward, stands holding on, sits with no support, pulls to stand, and squats and stands are indicators of the child's large muscle skills. By reviewing the rating scale, parents and educators can get a snapshot of the child's large motor development. And together they can plan experiences that take advantage of those things the child does regularly and provide opportunities for the child to develop others. Okay, so like all assessment tools, there are advantages and disadvantages to rating scales too. While rating scales can be easily measured behaviors, not easily measured by other means, a major disadvantage is that they can be very biased unless each descriptor is clearly defined and agreed on by everyone using the rating scale. For example, using the example on the previous slide, teachers must be clear on what sometimes means. Does it mean once a day or maybe once a week? Minimum training is required to use rating scales, and they can be very descriptive. They can also provide a quick visual of how a child is doing or how their development is progressing. Compared to a checklist, which just indicates whether a child can or cannot do something, a rating scale allows you to specify levels such as emerging and sometimes, which can give a more clearer picture of the child's development. You are probably very familiar with rubrics, as there's often a grading rubric attached to each of your assignments. Rubrics are qualitative instruments that provide indicators of performance that are used for assessment and scoring of work. We don't really use rubrics too much in early childhood. Rubrics are mostly used with older children and students like yourself, but older children who are in primary schools, but it can be an option when used appropriately with younger children. One of the first steps in designing a rubric is to determine what kind of rubric you want to use. There are several types of rubrics, but keep in mind that these can take on different appearances, such as the table above or as narrative lists. Holistic rubrics rate an overall performance and have a label that defines the level of performance. So you'll only see one indicator of performance, not several levels. Analytic rubrics rate specific tasks of performance using limited descriptors, so that several levels will be listed, usually with a score with each level. Developmental rubrics individualize according to personal performance, and they're used when assessing a multi-age group of children. The child is assessed on a continuum that shows developmental progress. The rubric shown here is a developmental rubric. The second step is to determine areas you want to evaluate. In our rubric for reading comprehension here, there are areas of illustrations, questions, and props. And then the third step is to determine the descriptors. And this can be difficult if a teacher is inexperienced. Descriptors include the traits that serve as the basis for student response, such as advanced, intermediate, and novice. And then next, you must provide the definitions which clarify the meaning of each trait. As we said before, rubrics are most commonly used with older children's work or products. One of the advantages of rubrics is that they can provide guidelines for quality or developmentally appropriate work. Rubrics are flexible and can be designed for many uses and ability levels. Older children can use rubrics to evaluate their own work too. However, in programs serving children 0 to 5 years, it's primarily the teacher who will be using the rubric. Rubrics must be used with caution for young children. You've got to keep in mind that young children may be at many different levels of development, even though they're the same age. Rubrics should only be used to show progress or explain in more detail what expectations are for typically developing children. Rubrics should always be modified based on examples of children's work. And like rating scales, rubrics can be subjective and difficult to create without experience. If you decide to create your own or use a commercial checklist, rating scale, or rubric, there are some guidelines you should follow before implementing their use. First, choose the tool to develop based on your needs. Then, develop consistency among raters. All adults using the tools should agree on what each item is intended to measure. This is extremely important, and I cannot stress it enough. All adults using the tools should agree on which item is intended to measure so that you're all using the tool consistently. The tool should be piloted by a teacher or a group of teachers and revised as needed. And scoring instructions should be available, and teachers should review scoring instructions prior to using these as an assessment tool. Okay, with so many tools to choose from, let's review again what considerations need to be made when selecting an observation tool. First, consider how much time you have to conduct the observation. Some tools may take more time than others to develop, and some methods, such as running records, take time to conduct. Second, consider the setting. If you're observing a child at home, a time sampling might not be appropriate, but anecdotal notes written after the visit can record a few important details about an observation. Third, consider what type of information you need. If you're a supervisor and a teacher reports a concern about a child in the classroom, you may want to conduct a running record so that you can get a wide scope of information on the child to get an idea of what specifically the concerns might be. Fourth, use a variety of tools. Using a variety of tools will give you a clear and detailed picture of a child's development. Select and create your tools carefully to collect the exact data you need. And finally, remember, no one can have a complete understanding of a child's development through just one observation. Many observations must occur over time and from different perspectives in order to truly know and understand a child.